We have a 5-year-old and want to be prepared. What warrants a trip to the hospital?
Well, here are 5 symptoms that should prompt you to call your pediatrician right now. First, incessant coughing. If your child just can't stop coughing,
Right.
or if it's getting worse after 3 to 5 days, or if it's gone 21 days and still hasn't gone away, time to call the pediatrician. Also, if they have another symptom along with the cough, ear pain, chest pain, or if they're having a hard time breathing, time to call the pediatrician. The next one, if your child has a fever with flat red dots. If your child gets a rash that looks like tiny little red magic marker dots and also has a fever, this could be a sign of a serious bacterial infection like meningitis. That can be life-threatening.
Yeah.
Now, we call this rash petechiae, and you can tell it's petechiae because they don't fade when you press on them like other rashes do. Have you ever seen that in your child? Hopefully not.
No, thank
Very,
God.
very scary.
I would have been calling everybody.
Yeah, exactly. Now, another one, if your child has a fever and can't move one of their limbs. If your child can't raise a lower limb or stand on one or the other leg and has a sudden fever, that could mean he has an infection inside the knee or the hip joint. That needs to be evaluated quickly because this is an infection that could destroy the joint if it isn't treated with IV antibiotics within 48 hours.
Ooh, I have to give you kudos because just patience, because I was on the phone all the time. Even as a doctor, I was on the phone all the time about anything that was happening with Daniel. And especially, you know how you get spit up on babies all the time?
Yeah.
If they have projectile vomiting or persistent vomiting, that's something that you really have to call the doctor about because this could be anything from food poisoning to torsion of the intestines, and you want to call your doctor right away, especially if they start to look dehydrated.
Yeah, that's a
and
big one.
babies can look dehydrated. I mean, it's different to tell dehydration in babies and adults. I mean, if they don't wet their diaper for what, like 6 to 8 hours?
6 to 8 hours, yeah.
If they don't make lips get dry, if they don't make any more tears, if their soft spot looks sunken.
That's a big one.
Yeah, those are all things you want to look at for dehydration because that can be a real good sign. Also, abdominal pain that's worsening and starts to last for a long, long time. Would you say like more than a
couple hours?
Okay, a couple hours. And because it can be a sign of appendicitis or something else going wrong, you know, so you really have to call your doctor right away. Your child usually lets you know.
Bottom line, if you're worried, call the doctor.